All right, so welcome everyone. Our workshop is entitled Shaping the Narrative with Intersections of Our Lives. We will start with some introductions, and since it's such a small group, I think we also have a chance to see who all is in the room. But for starters, my name is Lexi White. I use she and they pronouns. I'm the Director of State Policy and Advocacy with In Our Own Voice, National Black Women's Reproductive Justice Agenda, and I'll pass it over to my colleagues.
Hi, my name is Jennifer Wang. I use she, her pronouns. I am the Deputy Director of Programs at the National Asian Pacific American Women's Forum.
Hello, everyone. I'm Emily Champlin. I use she, her pronouns, and I am the Policy Analyst for Sexual and Reproductive Healthcare at the National Latina Institute for Reproductive Justice. Excited to be here with you all.
Awesome. Thanks, Emily. Would our guests also like to introduce themselves? If you feel comfortable, also feel free to use the chat if you prefer.
Hello, my name is Jason, and I use he, they pronouns, and I'm really excited to be here.
Hi, Jason. We're excited to have you.
Hi, my name is Michelle Ponce. I'm very honored to be here, and I am also part of the Arizona Reproductive Justice Coalition with the Arizona Birth Workers of Color. And thank you so much for having me.
Welcome.
Hello, everyone. My name is Prithika. I use she, her pronouns, and I'm really excited to be here too.
Great. All right.
I'm Asa. I use she, they pronouns. Hi.
Hi, Asa. Thank you so much for helping us today. All right, let's dive right in. So I wanted to just start with a few group agreements and would also invite everyone in the space to chime in on agreements that feel important to them. These are just a few that we, as presenters of this session, came up with together. First and foremost, we just want to say that what's shared here stays here, but what's learned here can leave here. Any personal information someone shares should definitely stay in the space. We're hoping that the lessons we learn together can eventually be shared far and wide. I do also want to share with everyone that we have some embargoed content in this particular presentation. We have some data from our recent Intersections of Our Lives poll, which we have actually not released to the wider public yet. And we won't be lifting that embargo on this content until the 28th of July. And so I just wanted to ask that when we're talking about some of the data from our poll, that folks just be mindful of that and respect that. And we're hoping to elevate the content from the session further after the embargo is lifted. So thank you for keeping that in mind. Please make space and take space. We are going to do some breakout group work in this session. We know it's a smaller group, so hopefully we have more of a chance to hear from everyone. But we encourage you to use your voice if you have something to share, and to also help to make sure that there's space for others in the space to share as well. We ask that you don't make assumptions in this space, except for assuming best intent, assuming best intention. This is a space where we want to learn and grow together. And so we ask that you don't make assumptions around people's experiences or identities, but do assume that they are sharing in the space and being brave and sharing in the space with best intentions. And is there any other agreements folks would like to add? And I also welcome you to use the chat box throughout the presentation and to contribute any other group agreements that you'd like. Next slide, Emily. All right, so we want to just lay some groundwork so that you know a little bit more about our collaborative and who Intersections of Our Lives is as a collaborative entity before we dive into some content.
The Intersections of Our Lives is a collaboration between National Latina Institute, In Our Own Voice, and the National Asian Pacific American Women's Forum. It is a vision for a world where we work together because we are only free as long as all of us are free.
Essentially, what we're saying is if you come after one of us, you come after all of us.
And what the intersections are is looking at the commonalities that we have. What do we face in terms of barriers to being able to determine if, when, and how to create a family?
Las leyes han cambiado y cambian según el gobierno necesita ciertas cosas y siempre hay unos puntos donde cada tipo cultural, cada grupo cultural ha tenido el mismo tipo de problemas, ya sea de sus derechos de inmigración o sus derechos de sistemas reproductivos o sus derechos como inmigrantes, y el poder ver ese tipo de unión es sumamente poderoso.
Reproductive justice is an intersectional concept. It's a human rights concept that says there are all these different pieces that impact on the lives of women of color.
I am not a woman on Monday, an immigrant on Tuesday, a mom on Wednesday, right? Like I'm those things every single day of my life, all of it.
This is about building a grassroots movement of women of color who can say to both parties, we matter. Our voices matter, our lives matter, and that you cannot ignore us anymore.
I often travel to Washington, D.C. for meetings, and oftentimes the halls do not reflect the color of our country. They are much whiter, much older, and much more male dominant than what I would see out on the streets.
I'm just checking, you all can hear this, right?
Yep, we can hear.
Okay.
Really thrilled to be able to come together for the first time in this historic gathering where we have 300 women of color, trans, gender nonconforming communities coming together to fight for reproductive justice. We're bringing the stories, the voices, the experiences, and the solutions of our communities to members of Congress.
The issues that we're raising during our meetings, visits with legislators and their staff, are on the HEAL Act and the Each Woman Act.
The reality that brings us all together is our universal need for healthcare and our access to our needs, such as abortion care. We want Medicaid to be able to cover that because there's so many people across all races, across all ideologies that are low income, that can't afford it, who should be able to afford it because their lives, their entire lives could be impacted by that one decision.
The best part of this advocacy day was watching Congresswoman Ayanna Pressley and Congresswoman Veronica Escobar give inspiring speeches where they encourage our communities to lift their voices.
We shake the table. We call the question. We are the preservers of democracy. We are the truth tellers. We are the seekers of justice. And so today you honor that long tradition.
My big hope is that people who got to know each other this time around will go back to their states and keep that going.
My advocacy is going to look different on so many levels because I have the opportunity to sit at the table with other women of color and share our experiences. So it's easy for me to bring their stories back to the legislators I speak to either change or create policy that's going to impact all of our lives and not just my own. I recommend joining this coalition of women of color because first off, we're badass and we can't do it without you. We need you. Remember, one voice, one sound. We create power when we're all together.
Awesome. And that was such a fun day. It was probably our biggest joint action yet in bringing hundreds of women of color from across the country to DC for a lobby day, which was really awesome. I'm rocking my Intersections t-shirt today. And all right, we are going to dive into some data just to give an overview of our session and how it will look so folks know what to expect. We're going to talk a little bit about our most recent poll and some field data that we newly have access to around women of color's political preferences and priorities and voting motivations in the 2020 general election. And we also did this poll back in 2018. And so we've seen a lot of changes since then. We're going to talk about some of the data, and then we want to really make this actionable and live. So we're going to be talking about messages, that are really centering intersectionality, which we talked about in the video, and give folks an opportunity to look at media messages that are effective and intersectional, and some that aren't, and to talk through how those messages might be strengthened in a way that holds a more intersectional framework and tells a fuller narrative around reproductive justice. And so I'm actually going to ask my colleague Jen to kick us off and give us an overview of our 2020 poll, which we're so excited to share with you. Again, a lot of this is not yet for public share. So once it is, we will also let you know.
Thank you so much, Lexi. So yes, of course, this is the embargoed version. Again, what people say here stays here, what you learn here leaves here. So general concepts are okay to share, but I would avoid sharing the fact that, there's this poll that's coming out and such number of whatever is the case until I believe the end of July, which is when this will be public. So first and foremost, as we saw in our last poll, women of color were very motivated to turn out in the 2020 general election. Almost 9 in 10 women of color voters told us that the stakes were too high in this election not to vote, right? So that means that as they were thinking about heading to the polls, as they were preparing to vote, we asked them, like, what did you feel at that point, right before you voted? And they said, it's too important to not vote. We absolutely have to. And unfortunately, as we saw in our previous poll, a large number of women of color voters had a hard time voting. They faced challenges voting. So 2 in 5 women of color voters told us that they faced some challenges voting, and this is actually an increase to 2018, which is not surprising. We all know what's happening right now across the country with regard to voting rights. Almost 1 in 5, or 19% of women of color voters told us that they were forced to show or asked to show their ID at the polls. Oftentimes that's something that's not required. And 11%, so roughly 1 in 10 said that they saw disinformation on social media, and 11%, also almost 1 in 10, or roughly 1 in 10, said that they faced long voting lines. Without surprise, the vast majority, or 90% of women of color, told us that they want to see more women candidates running for office. 85% said they wanted to see more candidates of color running for office. This is similar to what they've told us in our previous polls, and I don't think it's surprising, but it's good to have that concrete number out there. And I think the most important point that we see poll after poll that we do together is that women of color voters want to see an intersectional approach from the people that are running for office and from the people that we vote for and elect to office. 81% of women of color want their their representatives, want their senators, want all elected officials to understand how our experiences are not the same from white women and from white men and from men of color, actually. And that we have unique needs, and that in a lot of cases our values might be different, our approach might be different. As you saw in the video that we all just watched, you know, women of color voters can't separate, you know, their race, their ethnicity, their immigration status, their gender, their you know, education level, how many children they have from other parts of their identity. You know, we, as you all know, and as you all experience yourselves, we go about the world with intersecting identities, and we want our governments and people working in government to understand that. Next slide. Am I still doing this one? Okay, yeah. So wanted to get more specific on our polling data as it applies to reproductive rights and health. And we asked these questions in the 2018, right after the 2018 election as well. And we had a pretty good idea of what we would learn this time around. As you might think, women of color voters prefer language around reproductive rights to really be about our authority, our agency, our own control over our own bodies, rather than the language that you still often hear today about, you know, quote, keeping abortion legal, or keeping abortion safe and legal, or preserving the right to abortion, right? Like the way that we think about our reproductive rights and our reproductive health care is expansive. And that shows up actually in the polling data. So 3 in 5 think that it's extremely important to ensure that women have authority over their bodies and lives, compared to fewer than half think it's extremely important to keep abortion safe, legal, and accessible. Now, that doesn't then mean that they don't support the concept of safe abortion, of legal abortion, of accessible abortion. What that actually means is we think about these concepts as not siloed and distinct concepts, but intersectional concepts that affect the expansive definition of what a person might experience throughout their life as they go about, you know, accessing, seeking, and getting reproductive health care. 86% of women of color voters want their politicians to respect a woman's autonomy over her reproductive health. That statement polls exceptionally well with Black women, with 92% of Black women agreeing with that statement. And Lexi has even deeper, a slide with even deeper learnings about Black women voters later on in the presentation. And 2/3 think that abortion should be legal in all or most cases, including Latinas. And this is a 12-point increase since 2019. So like there is evidence that Latinas are actually getting even more invested and believing even more in pregnant people having authority over their bodies. And 8 in 10 women of color voters see that there are huge benefits to being able to control their reproductive decisions that are not just about the decision itself. So there's a slide about this later in the presentation, but I'm gonna kind of go into this in a deeper way right now. Women of color voters don't see like being able to access abortion or being able to get birth control or being able to have, you know, maternity care, like those things that mainstream society often views as happening once or just about that one thing. That's not actually how we think about that thing. We think about those things as affecting our entire lives. And AAPI women in the poll actually demonstrated that we have a very heightened sense of being able to say what those benefits actually are, including healthier children, right? So like the concept of being able to have reproductive agency, we think that leads to healthier children. We also think it leads to greater financial security. We also think that it leads to greater educational prospects. So there are all of these benefits, these intersecting benefits to being able to have authority over our bodies. And that's the way that we think about these concepts, right? And that's why this line that we often hear, keep abortion safe and legal, my body, my choice, the pro-choice, anti-choice dichotomy, that stuff doesn't really mesh with the way that women of color voters are thinking about these concepts. Next slide. And I'll turn it back over to Lexi to go over the deeper highlights about Black women voting.
Thank you, Jen. So what we saw in this poll pretty clearly is that one of the biggest motivations for Black women voters in the most recent election cycle was voting on a need for change. And, coming out of the last administration, there are so many reasons why, we can imagine that Black women would approach the most recent election with that sentiment. That said, there was, interestingly enough, a decent amount of optimism about the direction of the country that actually increased 40 points from 2019, and certainly is telling of increased sense of optimism that has come along with the start of a new administration. 66% of Black women think that, according to this poll, pregnant people should be able to access abortion in all or most cases, and that number was up 5 percentage points from our 2019 poll. I think what stands out to me, and this isn't something that as Black women we need data to tell us about, but having the data helps us to tell the story of our experiences. And 90% of respondents said that they wanted elected officials to know how white supremacy impacts their lives. 93% explicitly noted anti-Black racism, which unique to the experiences of Black women, and how anti-Black racism impacted their lives. And I just also wanted to flag that with that respondents and that on that point, who agreed most were young people. So Black women ages 18 to 24. They were also postgraduates. Many folks living in the Midwest specifically, and also higher income earners. And I think this is an important point, because as Black folks, we know that our experiences with white supremacy transcend economic status, right? And so I think it's really important to note that there are higher income earning folks who are making it clear that anti-Black racism is still very much a part of their experience, and something that they are showing up to the polls because of. It's a big motivator. Here are some of the top issues that are important to Black women, as evident in our most recent poll. Ending discrimination against people because of their race, ethnicity, immigration status, or culture. Reforming our criminal justice system so that it operates fairly and equitably. And that was actually an increase in 11 percentage points from our 2019 poll. Ensuring people with pre-existing conditions can still get health insurance. Reforming policies to address and prevent police violence. Stop making it harder for certain groups to vote. And that was up 6 percentage points from our last poll. And then ensuring access to clean water, which is something that I think surprised us in our last poll in that it ranked, and in this poll too, we're less surprised this time around, but in our last poll, ensuring access to clean water ranked in the top 3 across women of color communities who were polled. We also at In Our Own Voice had a previous national poll that showed us that 1 in 3 Black women who responded indicated having had brown water or foul-smelling water coming out of their taps at home. They also indicated that this was a real factor in terms of informing their own decision-making around pregnancy and parenting. And so, as we think about shaping intersectional narratives with legislators and in the media, it's going to be critical that we continue to talk about the intersections between our reproductive health and access to basic environmental needs, natural resources like clean water. Next slide, please. We also have a lot of data in this poll around how our respective communities experience the COVID-19 pandemic. For Black women in particular, top 3 ways they were impacted, including having experienced mental health issues or having noted that their mental health has suffered, having lost a family member to COVID-19, and also having economic difficulties, right? Having had to miss a bill payment or just basic trouble keeping up with bills because of some of the economic insecurities that came with the pandemic. And this was a concern across communities, specifically in terms of remedying the situation. Black women want to see financial assistance for families, rental assistance, unemployment benefits that are equitable, and access to basic food support like food stamps, as well as raising the minimum wage and direct cash payments to taxpayers. Next slide, Emily.
Thank you so much, Lexi. I'm just going to give a few deeper highlights about Asian American and Pacific Islander women. So I think unsurprisingly, similar to many of us, 1 in 3 AAPI women told us that their mental health had suffered during the pandemic. Again, not surprising, but good to have, numerical figures for what that trend is. Like I said before, this poll is not the first poll confirming this, but Asian American and Pacific Islander women deeply understand through their lived experiences what reproductive justice values are. 8 in 10 see direct benefits to being able to control our reproductive decisions, and they're connecting those decisions to broader benefits or increased access to other things that they want in their lives. And I mentioned a few, but I'll say, with more specificity, a few more here. AAPI women tell us that if they're able to control their reproduction, that'll create healthier families. It'll improve the quality of a child's life. It'll, provide greater financial security. It may increase economic and educational opportunities for the pregnant person. And that's the very definition of intersectionality, right? Like being able to connect the dots between a moment in time where you may need a reproductive health service to all these other benefits in your life. And so there's study after study actually confirming this out in the world. But the great thing about this polling data is that it actually confirms that is how our communities think about these concepts. Like you and I might know, but regular everyday people out in the world who have no idea about our movements and about our work know that as well, and are saying to us that that's how they think about this as well, which is powerful. More than 8 in 10 women of color voters agree that pregnant people should be able to have an abortion without fear of arrest or investigation. And the interesting thing about this is that people who identify as East Asian women are most likely to agree with this. Now, we don't know exactly why, but I think we can guess. So again, this is a guess, but there have been several high-profile cases of Asian people in the United States getting investigated, getting prosecuted, and then serving pretty lengthy sentences in jail or prison because of our pregnancy outcomes. Whether that outcome is a miscarriage or whether they maybe took abortion pills. This is something that has happened in our communities. It's happened, quite frankly, to, not just AAPI people, but Black women, Latinas. This is something that regularly is feared in our communities because of the several high-profile cases that have occurred of people looking at a person who is a person of color who used to be pregnant and isn't pregnant with a lot of suspicion, and then taking that oftentimes in a violently, law enforcement related way. And so this is a really good finding for us, that more than 8 in 10 women of color voters strongly believe that you should be able to have an abortion without any fear, without any fear of arrest or investigation whatsoever. That they are placing no values judgments on pregnancy outcomes of our people. It's a powerful finding for sure. COVID-19 for Asian American and Pacific Islander women has increased instances of racism and violence in our communities. And 2 in 5 AAPI women are saying that they've been personally affected by the increased racism and violence. Oftentimes what we experience, which shouldn't be a surprise to you all, is this like combination of racism and sexism intertwined, where you might leave your house to go to the grocery store and somebody might say something that is absolutely fueled by the fact that you're an Asian person, and absolutely fueled by the fact that you are not a man. So oftentimes this violence is like very much intertwined with our race, ethnicity, and our gender. And this is not in the poll, but we've also done some, separate research finding that Asian American and Pacific Islander women are reporting 2 times the level of racism and sexism and violence than Asian American and Pacific Islander men. And that is an intersectional understanding of violence, right? And so, again, doesn't surprise us that 2 in 5 AAPI women have said that they have been impacted, but it is good to have that number confirmed so that we can do something about it, right? So that this is not anecdotal. And 79% of AAPI women agree or really want my elected officials to understand how my experiences and needs differ from white women. Like this is it's going to shatter the model minority myth if people in the AAPI community and if people who serve in government, who were elected by all of us, can understand that AAPI people have unique concerns and unique struggles that are very, very, very different from the white community, because there are a lot of people out there who believe that we either are the model minority or that we aren't minorities and that we're all wealthy and highly educated and that we're doing just fine. But we know, because of disaggregated data and our own lived experiences, that that's just not the case, and that people are painting this picture of our community to use us as a wedge against other communities of color, and we have no interest in being used as that wedge. And that's really what that finding is about. Next slide. I'll turn it over to Emily to give the highlights for Latinas.
Hi, everyone. So I think like what this poll really highlighted was how COVID-19 was a perfect storm for Latinas and Latinxes. Almost 8 in 10 had been personally impacted by the pandemic, and 1 in 4 had a family member die. And they were also more likely to personally become sick with COVID-19 or take care of a member in their household who had gotten sick. And I think if we add on the context here of the fact that Latinas and Latinxes were a huge portion of the essential workers who had to continue to go to work. And then they also face extreme barriers to healthcare. So that is what created this perfect storm. And in some 2018 polling that the Latina Institute did, we found that 1 in 6 Latinas and Latinxes actually had been putting off healthcare already due to fears around immigration status and deportation. And so that's likely been increased during 2018 to now, which means that this is a pretty critical ongoing issue. And I think that goes to show why from 2016 to 2020, Latina Latinx voter turnout grew by 24%. Again, going back to that point of this election felt so important that they absolutely had to show up and make sure that their perspectives were counted. And I thought it was pretty interesting. These are some of the 4 top reasons that Latinas and Latinxes said they voted in 2020. Immigrants and the treatment of immigrants had a big impact on my decision, right? That's a constant lived experience that they have to navigate every day. And COVID and climate change, right? Like these are the communities that are being most impacted by the effects of these systems working together. Racial tensions in this country and the division Trump created in this country, and then also to bring a change in the way Black people were treated. I think there's a huge impetus here to recognize that when we're talking about, like Jen was talking about, people being criminalized for self-managing abortion, it's not actually self-managed abortion that's criminalized, it's identities, right? The people who are more likely to be reported to the police in an ER when seeking care are people of color and are people living at these multiple identities. So I think that's what's created this pretty big moment for Latinas and Latinxes that want to make sure that they are no longer, their perspectives and their intersections are no longer ignored. All right, I think Jen.
Yes. So as we have been saying and repeating, wanted to dive in a bit deeper to this finding, which is again the second time we've had this finding. But I wanted the group to understand just how different these 2 phrases poll with women of color voters. So the first phrase over on the left is keep abortion safe, legal, and accessible. In this kind of language, you can see that overall 84% think it's important, but there's far greater numbers of people who think that it's not at all important or not that important, and then far fewer numbers of people who think that it's extremely important, right? There's 46 over in that dark blue. And the lighter blue is at 26%. It's not a horrible. It doesn't poll horribly, but it's just not as strong for our communities. And you can see the breakdowns of by race and ethnicity down at the bottom. And it's very interesting to see that that's it just doesn't do as well. And then on the right-hand side, you have the statement, ensure that women have complete authority to make decisions about their bodies and their lives. This is 92%. It polls at 92%, which in any poll, if you're getting like figures in the 90s, it's just like it's an exceptionally strong finding. And you can see when you break it out by race, ethnicity, you know, it's stronger across the board, right? It's not just like one segment of our community propping this up. It's stronger across the board when you compare it to the previous statement, which is keep abortion safe, legal, and accessible. And you can see that it's not just that people think it's important to ensure that women have complete authority to make decisions about their bodies and their lives, but they're much more likely to say that it's extremely important. They're much more likely to say like, oh, not only is this like a deal, it's a very, very big deal. You also get far fewer people who don't know, right? Like if you look at the bottom, very last row, the don't know line is quite low when you compare it to the don't know line over on the lower left, right? Like it is a statement that is unequivocally about, you know, certainly reproductive justice concepts. And people really know, right? Like there are very few people who see a statement like this on the right-hand side, right? Ensure that women have complete authority to make decisions about their bodies and their lives. And like it resonates. They know it's unequivocal. Like there's very few people who are like, "Ooh, I'm not sure." So that's the point we really wanted to drive home in this conversation with you all, right? There's actual polling data out there that confirms that the work that we're all doing in the way that we're doing it is landing on people, not only because we're doing this work, because that's already how, but also because that's already how they think about these concepts. And so I just wanted to be transparent, put the data out there, show you just how big a change it actually is, and allow folks to see in those grids at the bottom, like just how different it is, particularly the people who think it's extremely important, and particularly the people who don't know. Next slide. So we are going to go into breakout groups. Actually, do we want to have a conversation about whether we have enough attendees for breakouts or whether we want to just do one large group and try to get through as many of these workshopped examples as we can? I mean, what do people have the appetite for and the energy for?
I definitely would love to hear from other folks, but I'm definitely open to keeping us in the full group if folks are open to that. I think it might give us a meatier discussion.
Yeah. Is there, oh, one group, please, open to what works. Okay. Well, is there anyone who really wants to break out instead of staying in the one group with the 10 of us here? Okay, so seeing no strongly opposed folks, we'll stay in one group. Oh, okay, one group, 2 votes for one group, great. So you'll see a link from Emily to the Jamboard, I guess, slides. For those of you who haven't used Jamboard before, it's very simple and very intuitive. If you all click on that link, there's a total of 14 activities. I don't know if we'll have time to get through all of them, but maybe Lexi, Emily, and I will lead you all through one each, and we'll see where we are at that point. Should we do the government actors first? Yeah.
That sounds great. All right. So definitely, I think a piece that often gets left behind by the main reproductive rights framing is a lot, but specifically disability justice, right? And there's a history of abuse by government actors for women of color and people with disabilities. And so I wanted to start with the case of Buck v. Bell. So Carrie Buck was a 17-year-old woman who became pregnant as a result of rape, and her foster parents had her committed to the Virginia State Colony for Epileptics and the Feeble-Minded, where her mother was also institutionalized. Both women were judged to be feeble-minded and promiscuous, primarily because each had given birth to a child outside of marriage. After Carrie's daughter Vivian was born, the superintendent recommended that Carrie be sterilized. Carrie's child Vivian was also judged to be feeble-minded following a cursory examination when she was only 7 months old. So the most infamous quote here from Supreme Court Justice Oliver Wendell Holmes: "It is better for all the world if instead of waiting to execute degenerate offspring for crime or let them starve for their imbecility, society can prevent those who are manifestly unfit from breeding their kind. The principle that sustains compulsory vaccination is broad enough to cover cutting fallopian tubes. 3 generations of imbeciles are enough." And I just want to add here that this is still technically good law. It's never been overturned. And I kind of want to get what that feels like to people. Does this ring a certain way for you? And if you can put in these little sticky notes, you can choose a color and then hit save, but just your first kind of gut reactions to this history that still lives. What do you all think about any connections to current events? A hard agree with, doesn't surprise me. Very white, very male Supreme Court. Ooh, a cop-out. Inability to deal with the actual problems. I think that's a great, great point. Does anyone want to expand a little bit more on that? I think that just hits it right on.
Sure, I will. You mean it like this, like in talking?
Yeah, absolutely.
I think that the myopic sort of like reaction to something that might seem disgusting or shameful, which is usually the woman's body or the woman's reproductive, or like from just lack of knowledge, right? There's so much lack of knowledge when it comes to the males or the, white supremacists or the white. There's just so much lack of knowledge of what involves in a woman's body and sexuality and physiological, that it's hard for them to even fathom not knowing and not having that awareness, that the first reaction is just like, we're going to cut it. We're just going to go ahead and cut everything off. Like we're just going to, let's just shut it down because I don't get it and it's too hard and I can't deal with it. And what, rape, all that, it's so much shameful that let's just like, out of my space, out of mind, out of sight. So it's sort of like a cop out of, because I feel like, they usually masculinity in terms of like this toxic, they're not really able to dive deep into the deeper, harder issues that happen, right? Like when there's a big problem that's complex, or if it's, beyond their understanding, they haven't been equipped with that ability that a lot of femme or female energy, and historically we deal with the afterbirth, we deal with the period, menstruation, we have to deal with the hard parts of being human, and there's no cop out for us, we have to deal with it. But for them, they can just sort of be like, yuck, get out of my face, and so it's sort of a cop-out, and it's a weakness really more than anything in their brutality or in their, you know, in their harshness or in their, they actually show how weak they really are in addressing and meeting those things. So that's my reflection on that.
No, I think that's so well said. It's too hard, so let me just get it completely out of my face. And the audacity, right? The audacity that I can make this decision even though I have no tangible connection to any of these intersections, right? Definitely hard agree. Blatant dehumanization, yes. Yeah, it's very rage-inducing. Now, ableism, when talking about reproduction, continues to this day, right? And if we want to continue on to the next little Jamboard slide here, I think there is a Supreme Court case that is going up right now about whether or not abortion bans for fetal anomalies like Down syndrome is going to be constitutional. So what we have here are two statements from two different representatives. And then at the bottom with the gold stars are disability rights and justice activist responses. So I want us to go through these, just kind of read them to yourselves, and then using the sticky notes, what are your first reactions? What do you think the top two are missing? And what do you think the bottom two are really nailing on the head? Oh, I like this. The bottom quote center bodily autonomy for the person. So what do you all think about Corey Dunn's response? We didn't ask for this. What does that strike for people? It strikes me as extremely paternalistic. extremely infantilizing, which is a problem people with disabilities are always facing, right?
I would say also it's just reticent of just how supremacy generally views people that are different. Generally speaking, it's like you can't help yourself. You're gonna need us to go ahead and, you know, put you right and take care of you, you know, fight your fights for you, because God knows you are helpless without us. So, you know, we're being good people by helping you. And so that just kind of calls out saying, we didn't ask for this. No, thank you, which I love.
Yeah, I really like Rebecca Coakley. I have such a crush on her. And I love her well-meaning non-disabled public, right? The well-meaning non-disabled public. And I think that's constantly the voice that's overshadowing those who actually live at these intersections. So I know.
Oh, sorry.
Oh, no, go.
I'm also just thinking about like this idea that they're ensuring the rights of individuals with disabilities are protected, but like they don't want to give disabled people like housing or like adequate medical care or like anything like that disabled people actually need to like survive and like thrive in the world. They just want to immediately jump to like cutting off the opportunity for disabled people to exercise autonomy over our bodies. And it's like, it's just bullshit, you know? Like
1000% yes. It's all a facade. It's a very thinly veiled attempt, right? So I'm not sure, Lexi and Jen, do we want to switch into some of your material, or what do you think?
Sure. I'm happy to. Lexi, do you want to go next or should I?
You can go next, Jen.
Okay, so I'm gonna paste a link in the chat to slide 6. You can either click on that link or you can toggle over with the arrows at the top. You should see a slide at the top that has a green title. It says "Our Reproductive Lives Beyond Binaries: Shattering the Pro-Choice, Anti-Choice, and Good/Bad Abortion Dichotomies." Yes, it's slide 7 in the deck, but it's slide 6 in the link that I just sent.
Okay.
And then the two quotes in the slide are "My body, my choice," which is something that you hear a lot, and over on the left, "The human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities." So I think it's worth talking about the limitations of the first talking point, which is still one that we all see today, and actually is one that we commonly see now coming from an entirely different segment of our country, where, you know, you used to only ever see "my body, my choice" being used as a reference to abortion. And now you're actually seeing it get co-opted by people by COVID deniers, by people who want to spread lies about the vaccine, and they're using it to, you know, make the point about individuality versus the community. Is an observation that I think we've probably all seen. But I'll give folks a chance to digest these 2 points and to answer the 2 questions on the sticky notes. So first, what are the limitations of the "My body, my choice" talking point? And second, what do we gain from having an expansive talking point like this one, where we are talking about bodily autonomy, the right to have children, to not have children, parent the children we have in safe and sustainable communities? I'll give you all a couple minutes. Okay. I love the one about how the quote about the human right about bodily autonomy talks about systemic problems beyond abortion. Similar to the point that we all discussed in the last slide about disability rights, that like people are trying to solve a problem without actually solving the problem. Yeah, historical reproductive harm out of their control. I mean, that showed up a few different times on here. Does someone want to expand upon any of the points that they made? Sounds like it's pretty self-explanatory with this one. And we only have 20 minutes left. So Lexine, perhaps we can move on to the final example.
Yes, thanks, Jen. I'm going to move over to slide 9 in the Jamboard. You can use the link in the chat as well. And I wanted to talk a little bit about narratives around young people's experiences with reproductive decision-making, specifically thinking about how teen pregnancy is contextualized and talked about, you know, both by government actors in the media, popular culture, et cetera, in ways that really limit young people's, you know, agency over their own bodies and lives, and ability to make those decisions on their own. But you know, also in our laws, right? 37 states have laws on the books that require a young person to obtain parental consent from an individual who, you know, would essentially deem them fit enough to make this decision for themselves. That's certainly something that we are pushing back against, but we are also doing so in a way that wants to be affirming of young people's not only ability to make these decisions for themselves, but you know, their full range of experiences with regards to their sexual and reproductive health, and even thinking about the resources and supports that young folks might need to access as they become parents. Anyway, now you know my position, but I want to share this quote. This quote I found, the first quote here on the left, came from, I think, the Federal Office of Population Affairs. It says, teen pregnancy prevention is more than sharing reproductive health resources. It is about connecting youth to services and opportunities that will help them reach their full potential. When we work to prevent teen pregnancy, we help youth achieve their full potential. And so I'm looking for your thoughts on what's limiting about this framing. And you know what, we'll do 2 for 1, since in the interest of time. Over to the right, I also have a quote from a senator in Miami who said this in response to a bill that was trying to expand parental consent restriction, or expand parental consent in Florida. So basically making it more difficult for young people to access abortion by enforcing more stringent parental consent regulations. And this senator said the following: the way I see it, it's just a forced conversation on something that will forever, ever, and ever change several people's lives. And that's what we're asking for. Can there please be a conversation so that the little girl doesn't have to go through this by herself? Does anyone want to share or expand upon their reactions to either of these?
I would, I know I like to talk a lot. You know, the first one, it kind of reminds me how deep the problem really is when it comes to reproductive health. Like, I feel like when we start talking about when we start talking about addressing it in teens, we're already too late. You know, like reproductive health and what affects teens and how they see their bodies and how they make decisions, it really starts from the get-go, not only from their family, but from the media. And so when we're talking about like preventing teen pregnancy, and we're saying that, you know, we're talking about in the teenage years to help provide resources to prevent anything like it's just so myopic, you know, because it has so much more to do than whether you give a teen a pamphlet or not, you know, whether they know how reproductive body works. Yeah, that's important too, but it's how we've been taught to navigate our bodies and sexualize our bodies from a very young age. So there's a certain amount of like, it's so much bigger than what it seems to be. And I feel like it simplifies what teenagers think or feel, or how, you know, how they make decisions. I feel like older people tend to think that younger people are kind of dumb, or sort of like, you know, just not able to grasp, when what we've noticed now is that every generation that comes is just so much more able to digest big pieces of information and understand who they are much more than we ever thought we did at that age. So to me, I'm just thinking about the language that's used when it comes to dealing with young people and their choices and how they think about things, and sort of not assuming that they don't know, you know.
Thank you for sharing that. And I think, you know, there's such a focus in the first quote on preventing pregnancy as the goal, right? And I agree, it would take out, you know, to take out full potential, it seems shamey. Pregnant teens are not lesser than, and, you know, who are we to suggest that a young person who becomes a parent, you know, wouldn't be able to achieve their full potential. And so I think, yeah, there's such a focus on the prevention of pregnancy itself. And certainly, you know, with our framing, I'm actually gonna go ahead to the next slide. You know, we want to open the conversation up a bit more. So I would think this is a bit better messaging. Black, Indigenous, people of color, adolescents, including LGBTQ+ young people, must be able to access culturally competent and gender-affirming sexual health education and have full agency in decisions about their sexual and reproductive health, including pregnancy and parenting, without coercion or shame. And invite folks to chime in around, you know, how this, what we gain by using this kind of a frame.
I think it's like really important to actually name that coercion and shame are often like elements in like people's discussions about reproductive care, because like in the prior slide, people use like full potential and potential as like these supposedly neutral terms that like aren't supposed to like induce shame in people, but they do anyway. So I think it's like really key that like any type of reproductive health care we're like trying to give people is like actively identifying shame and like trying to root it out before it can actually like reach any like youth.
We have a lot of shame in our conversations around sexuality and reproduction. So I think having that like eagle's eye out for wherever shame pops up and getting it out of there is a great point.
I love it too that they include coercion and shame. I think that those things are not often talked about enough as to what drives a lot of decision making when it comes to these things and how they control, how the mass population has been able to sort of follow along because of they feel shame, wow, if I get pregnant at 13, I got a lot of shame. So let me just let you make decisions for me, right? Because that means I did something wrong. So there's so much that as femmes and just people in general that we're shamed about. It just makes it so much easier for people to go around making decisions and assuming what we need and want. So I love this idea of talking more about shame and how that drives a lot of the things that people decide to do to us.
Thank you everyone for sharing. Jen and Emily, I have another one. I know we're at 10 minutes. What do we think about time?
What if we put it to the group? Does the group want to do one more, or would we rather come together and discuss the broad themes and lessons learned? Maybe folks who want to do one more, you can do a thumbs up reaction. And maybe those who want to come back together and discuss, you can do the heart reaction. I see a thumbs up for one more. Another thumbs up for one more. Oh, Michelle wants to do both. Don't know that we're going to have time for both. It sounds like one more is winning out. So let's do one more.
Okay, sounds good. Okay, so now I'm on slide 11 in the deck. Let me know if anyone has trouble seeing it. But so talking about pregnancy-related care and experiences, without giving a primer, I guess I just want first reactions to this one and how we might make this more intersectional and more inclusive. To address the maternal health crisis in America, congressional leaders must continue to fight for critically important policies like 12-month postpartum Medicaid coverage, which would ensure moms have access to the care and support they need and deserve for the full postpartum period. mean, I think this group really nailed it in terms of your assessment. I'm going to go ahead and go to next one and just share this quote from Caden Coleman, who's a trans father of two, who spoke out widely in the media about trauma and discrimination from medical providers during both of his pregnancies. He said, there was a lot of questioning about my identity, a lot of misgendering, being told I shouldn't be in spaces I was seeking care from because they were considered women's spaces. I was offered an abortion a ridiculous amount of times. And so I pose the question here, what do we learn from the statement about how our movements should talk about pregnancy-related care and experiences, and which abortion-centric ideals need to be addressed? Yes. And I fully agree. Thank you all for sharing your thoughts. It's critical in our messaging around pregnancy, birth justice, pregnancy-related care that we are using gender inclusive language, that we are not suggesting that gender expansive people do not navigate reproductive health care and pregnancy-related care. And certainly we need to tell the story of the stories of the unique experiences of not only racism and gender discrimination, but the ways that that presents as trauma in medical systems and in healthcare settings. So thank you for your reflections. Jen, what do you think? Should we?
I think we got to close it out because folks probably have to be on their way to their next thing in the conference, next agenda item in the conference. But thank you all so much for gathering with us over the course of the last 90 minutes. I hope that the poll results confirmed that what we all are doing is working, the way that we're communicating about our work and its importance is resonating with people, because communities of color already think about these concepts in exactly the ways that we do. I see that Emily has put the link to our Intersections of Our Lives landing page in the chat in case anyone wants to learn more about our collaboration or about any of our 3 organizations. And thank you all so much. And thank you to Spark for creating the space for us.
And I'll just add, I'd like to follow up with Spark to send out info for our upcoming official poll launch and briefing, which is coming up on the 29th. We have a press event on the 28th, but we are having an ally briefing on the 29th. And so if we can connect with Spark for folks' email addresses, we'd love to send that to you to invite you. Awesome.
Thank you so much, everyone. This was really great.
Thank you.
Thanks, everyone. Take care.
Bye, all.
Thank you.